But what I've tried to do this time is not to give you any information as to what we have really done, but what is my wish list, even today, when we look at uh, hematology analyzer and what Dr. Sukesh likes to call hemocytomorphometer, when we look at that particular instrument today, we still have certain wishes which, again, are kind of coming true. So this is the place where I work, and I bring you warm regards from there. And of course, my team, we have some of them here as well. And I don't have any specific disclosures to make except for the fact that this is a Mindray platform on which I have agreed to talk about this whole thing. So evolving paradigm of hemocytomorphometry from cell counts to morphology and now beyond, where that's why we've named or themed our conference today as ECTC. The concept was that we've added ESR to it, we've added CRP to it, and now it no longer remains just like a hematology analyzer. It's actually convergence of technologies which we've tried to do. And this is primarily because of the fact, because when we were kids, this is a poem which we would be, kind of rehearsing all the time. And they would say if wishes were horses. And wishes today are getting true. There are a lot of things which have already come true. Now, in the last decade or so, in fact, sir has already mentioned to you that, I was a consultant hematologist. I moved to become a director of the labs, and I am still working as in such position. But a lot of things changed in the world in the last decade or so. At a personal front and the official front, we moved from a typical burgundy color, which used to be the color of my presentations previously, to more bluish and greenish and stuff like that. So that's the biggest transition which we have had in the last almost a decade or so. And this is where we were, and this is where we are today, as far as the organization itself is concerned. And beyond that, also, there are a lot of things which have happened parallelly, and I'm sure all of you are kind of aware of that. I'm not sure how many of you know these two guys, these two gentlemen. Who were they? Any idea? Any guesses? Come on, nobody can forget them for the rest of their lives. They were the ones who gave you the so-called WhatsApp. All right, so these were the WhatsApp creators in the world. And of course, that's something which has become a part and parcel of our life, the encrypted information which goes across to all of us. And more important than that, let's forget about the Facebook guys taking it over. But what's more important is how WhatsApp has changed our lives today. When I don't have access to digital morphology on a cloud-based system, I'm still able to get a PDF of my morphology from the AT analyzer on my phone. And that's where things have changed, how you have really evolved over the last decade or so. We've also evolved that, as Dr. Tejinder has presented in his presentation also. There is NGS, which is the new kid on the block, and everybody wants to not only talk about it, but do it also. And of course, there are lots of new entities and new things which are coming up. Even the classification today for hematological malignancies has changed. We know 2022 book, which has just been launched in hard copy. Of course, it's exorbitantly expensive this time in double copies. Do you know how much it costs today? The maximum retail price is 18,000 bucks. It used to start at about 2,500 when I bought the last one. Now this time, with a full discount, you still have to buy it almost at about 12,500. So that's changed. So everything is becoming expensive. And at the same time, it's also important for us to realize the technology is moving forwards. We know we are in the era of digitization, especially in the last 4 years. That's what we've seen as a big transition post-COVID. So, we are at the kind of a junction between the past and the present, the future. And at that moment of time, we're all now looking at the sci-fi. This is something which we had kind of envisaged. When I was a kid, I would watch Star Trek and I would think this is all, rubbish. It can never happen in real world. But now, we know it happens and things are happening. You saw the news just yesterday how those small little pages were blown up in Lebanon. Right? So that's the kind of power what we're talking about technology today. And how can analyzers be far behind? So what I have done in my talk today is I've again gone back into the history a little bit. We'll again talk a little bit about a Coulter principle, a little recap about that. We'll talk about a little bit about technologies, some analyzer common antiques which are available, and then we'll also try to make some more sense of the automated data which is coming out of the analyzers today. So if we talk about history, a lot of it has been spoken about by Dr. Tejinder Singh, so I'll really not spend a lot of time on it. But just look at it. From early 1900s, where you were just looking at cells, at small little particles, and because you were able to stain them under a microscope or under a Newber's chamber or whatever you were wanting to put it onto the microscope, to a Coulter instrument from where you were actually able to count the cells quickly. And then, of course, we talk about many part analyzers today. And we all moved from the classical macro world to the micro world. And of course, we cannot forget the man down there who was the one who was instrumental in giving us all this into a many part analyzer today. Again, I'm not getting into details of this because this is something which we already know. So where have we started? We have started way back from just the routine regular staining on a slide up to a hematology analyzer. And lots of things have still not changed. We're still kind of looking at manual versus automated. If you look at platelets, we're still wanting to see a manual count. In fact, we start getting requests for manual count. Why? Because we kept giving comments in our report saying, this has been checked manually or this has been done manually and stuff like that. So people have really gone into it significantly. Of course, these two gentlemen, the younger days, the Coulter brothers, and eventually when they became older, we all know how they have changed lives for all of us. And of course, the first aperture, the history of it, I've given so many times previously, I'll not get into details of this. But there was a very interesting story, which in fact stands published also about it. And they say when these brothers went to the US Patenting Authority for asking them to give them a patent for this technology, all they were told is, you can't patent a hole. Well, as they say, the rest is history. They were eventually able to get their patent for this, and eventually they did talk about get an instrument in place, which we all are using now, and that technology stands today even after almost 75 years of its existence. The interesting part of this whole thing is that did we really start from the impedance analysis as far as the hematology analyzer was concerned? The answer is no. In fact, the first step was a fluorescence-based cell counting long ago, and of course, a lot of it was done in a lot of other cases. And we also know about the Coulter principle. I'm not getting into details of this, but this is one histogram part of it, which Dr. Sukesh always tells in his presentation. If there is one thing which he would always want to keep intact, and that would be this particular graph. And rightly so, because it gives you the cells in the most native state, and you're actually able to get the information from it, which is pretty varied. And from there, you are able to actually decipher a lot of information as well. And of course, I did tell you about the patent, which was for the flow cytometry part of it. This was the light scattering instrument, which was using the red blood cell volume and hemoglobin concentration. And of course, the Epstein was the one who gave us this whole thing, the Technicon instruments previously, flow cytometry based. All this was done long back ago. So if you look at how and why we're talking about analyzers today and how they have evolved over the years, the concept was primarily revolving not around hemoglobin or not really around platelets. It was primarily revolving around the white blood cells. Okay, and that's how the whole concept came up. You were talking about the routine 3-part differential and then the 5-part differential. And this whole concept came about from this small little thing which we're using in our laboratories, and we still have it in our laboratories today. And that was a hemocytometer. That's where the origin of the word comes, which Dr. Sukesh uses in his presentations very often. Now, if you look at this particular counting part of it, what were we trying to do when we were trying to count? We had certain reagents which we were using. We had the distilled water there, which was meant for lysis. We had the gentian violet, which was meant for staining. And of course, we wanted to keep the pH at a certain point, put it across into the chamber, and then using the grids there, we would count them. And of course, we knew that we had that factor which we would multiply and give the counts out. Right? So I want you to remember this part of it for sure. So you had lysis, you had staining, and you were adjusting your pH, right? This is what you were doing manually. And what happened when we went on to the hematology analyzers? We did the same. We just got our chemical reactions, we lysed the red cells, we stabilized the white cells. In some cases, we permeabilized them, we used a dye into it, sometimes we never used a dye. And to expedite the whole process, what did we do? We kind of heated the whole thing, put it at a temperature which was higher. And then once we got all that, the cells were processed, got into the analyzer, and it gave us the information in the form of a visualization. Now, previously we were looking at it under the microscope, and now we are looking at it from a hematology analyzer standpoint. So practically, if you look at this whole concept, you're still doing what you were doing manually. The only thing that you've changed is you're expediting it, and you're using reagents in certain concentrations to make sure that the cells are able to give you, that reaction what you're expecting quickly. And eventually, all this you're getting into form of a digitized scatter plots and histograms. So it's as simple as that. You've only transformed what you were doing manually previously, and putting onto a hematology analyzer. And that's how the entire automated differential counting came. So you had this 5-part and the 3-part and the stuff like that. And obviously anything which was nucleated would interfere in your analysis. And now you started asking for more. You said, okay, I got my counts, great, but now I want to know that my NRBCs are counted correctly separately. I don't want to do an uncorrected and a corrected leukocyte differential, etc. And then again, we worked on certain reagents, modified the mechanics of, of the instrument in such a way that we were able to get all that information from the analyzer itself and getting the information regarding your white cells, your WBCs, your RBCs, and a lot of other parameters that we were talking about. So if you look at parameters which are available today, just look at the number of parameters which are available in all sorts of analyzers. And I've not specifically pointed out a specific analyzer here. There are all sorts of information which is coming. Look at just 32 parameters for the red cells, including the calculated ones. You have almost about 27 to 30 parameters which are coming for your white blood cells. And again, about 71 odd parameters, which is like counting all of them together. Now, when you look at all of these parameters together, the information is amazing. Add to this the research parametric data or the cell population data, which we have already seen in our laboratories and are working also on it. And some papers have also been published by Dr. Nair and others. So in such, look at the information which is coming out from a hematology analyzer. It's almost about 150 to 200 parameters that you potentially can work on, and it can actually help you define a disease and get into the nitty-gritties of it. So I'll change gears a little bit and I'll tell you something interesting new, what is happening now on some of the analyzers, keeping in focus the Mindray's newest stuff which they have added onto it. I was invited for a talk some time ago, a few years ago, in fact, prior to COVID, where the talk was about using platelets, worrying about platelets at the time of monsoon. Monsoons, rains, mosquitoes, and the problem of platelets which starts coming up. And at that point of time, I had labeled my talk as the ooh, the ah, and the ouch of the platelet count, only to make it a bit catchy, nothing else. Little did I realize that now I'll be also talking about the I's, the O's, and the F's, and now the H of the platelet count. So, how platelets have also evolved, because platelets still happens to be one of the most dynamic and most controversial parameters, if I may call it so, because counting them still happens to be one of the biggest challenges which the industry is facing. So when we talk about platelets, the I, O, F, and H, they all stand for impedance, the optical, the so-called fluorescent, and then eventually now the hybrid platelet counts. And this hybrid platelet count is nothing but a count which has been taken out from the impedance channel and has also been added from the retic channel, and then the differential ones. And now once you've gotten the combination of it, you remove all the red cell debris, etc. out of it, and finally you give a count which is called the platelet hybrid count. And it's been claimed that gives you information which is almost equivalent to what you would have otherwise done manually. And they have enough studies available on this. I have no direct work on this at the moment, but we are planning to work on this, and hopefully we should have some data next year with you. So practically speaking, we've added another armamentarium to the platelet counting from where we started, the I's, the O's, the F's, and now the H. All right, and now the theme of the conference. We're getting into what is called technological convergence. We had COVID. We were looking at so many parameters at that point of time. We wanted to look at CRP. We wanted to look at D-dimer. We wanted to look at so many other information, IL-6, etc. The question was, can I have one single sample which goes across into the system, and I get all this information from that analyzer in one shot? And that's where perhaps the entire convergence came in onto the analyzers which were from Mindray, and this was primarily working on the CRP and the ESR in this analyzer. And they have again done enough studies on this. We are kind of in the process of actually looking at this in our center also, and looking at ESR, getting the ESR information done on a what they call more and less, and more importantly, converging the other technology where you were looking at classical vestigrants to a charge-based ESR identification, and getting that information from the same tube which went into the hematology analyzer. And finally, looking at CRP by embedding what is called the lattice-passed particle-enhanced immunophenotypic method within the analyzer. So you have another channel in which you are identifying the CRP. So you now have a technological convergence, right from your classical impedance to fluorescence to hybrid and then to add to it ESR and CRP and latex agglutination, stuff like that. So therefore, real technological convergence which is happening across the platforms. All this done, do we still have issues? Yes, we do. So we still have issues with hematology analyzers. We have numerical data, but PBF sometimes can be a challenge. Even with digital morphology platforms on board, and we do have one, we can still have challenges there. Graphical data, do we really utilize it to the maximum potential? The answer is still no. A lot of people don't even look at it at the moment, even today. And then finally, to emphasize that having automated data and compiling it along with the information which is coming from the rest of the parameters there. All this complex information which is coming, can we just collate it together and give a clinical decision basis this? Is something available on that? Yes, the answer is again yes. We do have something called clinical decision support system, but again, very sparingly utilized in majority of the states across the country here in India. And again, it is also important to realize that you can have sometimes very complex and time-consuming preparations of certain samples if you do not have an integrated solutions to all of this. And of course, we still have a need to draw the sample. You can't do anything unless you have a sample with you. So can I do something, maybe on my watch something comes up and says, oh, your hemoglobin at this moment of time is 14 grams. That would be something which would be wonderful. There's another very interesting thing which I want to put across to everyone. Reticulocyte counting on different analyzers is not the same. You don't get similar numbers. So don't chase the numbers, just chase your instrument. And every time you do the instrument, you are expected to have it like that. But why is it so? Is because if you see, there is a reference method against which you are actually standardizing your instrument. And this is never a straight line in between. So if you have tilted lines the way they are, whatever you will count here will be kind of matching at the lower counts. But the moment you go to the higher ones, they may not be the same numbers. So therefore, counting across counters as far as the numerical data of reticulocyte is concerned, it may not give you exactly the similar information. So this is something which we all need to keep in mind. In addition to that, there are other unique issues with pediatric samples. I'll not get into details of this, but again, having samples in that small microvac and then trying to put it into the analyzer itself, running it into a single shot can become a challenge. And lots of other smaller little issues wherein lysis of the red cells may not be adequate, especially in some of the hematology analyzers without naming them. So there are issues even today. While the paradigm is evolving, we still have things to do, and therefore that gets us to the question, what's my wish list? Obviously, ye dil mange more. We want to have something more in life, and what else do we want? We want more accurate, more comprehensive instruments. We want to include more parameters in the blood counts. We want to look at the rare event analysis. I wish I could just run a sample of my stem cell analysis without, kind of pre-preparing it myself and just putting it in the analyzer, and it gives me the stem cell counts. Maybe detect some tumor cells, do some in vivo testing, which we do otherwise also on the analyzer. And of course, there are issues when we have clumping of the cells, and that time, can this give me something more? I don't have answers to all this at the moment. Yes, there are lots of things which are in the process, and I'll just give you what's on the anvil and what's probably already come in. There are some novel methods which are kind of in development at the moment. We have some quantum dot assays which are coming up. We have some small portable instruments which are also working at the same time. And of course, what I wish eventually, an in vivo blood counting technique which might come up at some point of day. We have newer contrast reagents like the quantum dots which I was telling you about, and of course the rare earth metals. But the moment you talk about these two things, you are now escalating the cost to the next higher level. And of course, at the moment, it's still kind of a research tool. And more importantly, how do we use eventually all this data which is coming to us to make sure that it's giving us the information that we want? We're in an era where we've been through COVID just recently, and a lot of people are actually still wanting that I sit in my nice cozy bedroom and somebody just walks up there and takes my sample, or actually not even takes my sample, gets me the information from my Fitbit and tells me, okay, you're doing well today, or you're not doing well today. So stuff like that. So that's what we are coming to the next. And of course, the need for portability of taking the instrument back to the patient somewhere in the remote areas. And now that is the biggest challenge that we face today. But has there been portability, which we are trying to talk about? The answer is again, yes. There are a lot of things which are happening on the portable part of it. And as Sir has also mentioned in his talk, the lab on the chip. In fact, there is a journal to that effect by name, The Lab on the Chip. And that they talk about how chips are being used today to ensure that we're able to give you exactly similar information on micro samples from a finger prick and get you the information which you want from a small drop of blood. Digital morphology and microscopy we have already spoken about. In fact, sir has also spoken about it, and I have also given you some information in my last presentation last year. And this has evolved significantly over a period of time, and it's becoming better and better with added machine learning technology, both on Mindray and on television platforms. These are some data which has come out from our MCAT, which we've used in Delhi. And you can see that it's been able to identify all of these abnormal cells and actually gives me very clear morphology and tells me that your sample is actually containing blasts. And of course, we all know the beautiful information which it gives you, like the ones which you would look at the textbook and feel great about it. All that information is now available at the back of your hand. And again, not only looking at red cells, even identifying them separately, and counting them also is also equally important. For example, these abnormal macrocytes, you're able to pick them very distinctly, enumerate them very clearly, and look at this beautiful, the digital morphology picture of a basophilic stippling. Now, this is something which the analyzer is doing it for you and actually identifying it for you, and then finally you just have to look at it at your leisure and just report it out. So that's the next last thing which perhaps is still kind of on the anvil, which is happening. There was also a resurgence of what I called the image-based cell counting, and unfortunately it never saw the light of the day. And this was the so-called classical bloodhound instrument, which was there from the Roche Diagnostics M511, which eventually did not see the light of the day, where they were doing the printing part of it on a slide and then eventually taking image analysis. Unfortunately, it never happened. It did happen, but it did not happen eventually on a commercial level. And again, looking on a chip, as I already mentioned to you. Finally, and not last but not the least, we are now looking in an era, we're looking at in vivo analysis of your blood cells. So, it is just maybe a few more months or years where we will be actually looking at our watch and saying, okay, my hemoglobin at this moment of time is 12 grams and my platelets are 3 lakhs. Okay, I'm good today. And next day when you see that my platelets have dropped, you say, oh do I have dengue now? Shall I look for my dengue? That kind of a thing. I think, it's pretty exciting what you're looking at as far as the in vivo automated blood cell counting is concerned. There are a lot of things which are already happening. I'll not get into details of this. I have no direct experience of this, but I have read through this and I've realized that yes, things are changing and the speed is actually pretty interesting as to what is happening. So we have a lot of technology which is on the anvil. We have optical absorption, we have elastic scattering, we have inelastic scattering. Don't ask me what all this means because I really, really don't know all of this. But what I know is that things are changing and they're changing at a rapid pace. The only thing is, how much of a pace do we keep with it? And how much are we willing to adopt in our routine practice? Whether we like it or not, the technology is going to come in. And we are definitely needing to make sure that we adapt to it as quickly as we can. So therefore, I leave it with you with this slide, not really confused. I don't think you guys are confused, but I'm still confused as to where we stand at the moment. But I still expect that my wish list, what I had, the analyzer science is actually going to evolve and grow and grow and grow and further. And of course, we want to see the beautiful small little marrows, the special techniques, etc. Of course, the money part of it, which my colleague Tina is going to teach you tomorrow in a big way as to how to earn money from money. And then finally, it's also important when you try to adopt this technology, into your systems, what are your driving and your restraining forces? It's not just about just getting something on board. It's also about the fact that what are you trying to do? What's your lab size? What's your scope? Are you public or private? Do you have operations which are 24/7 or not? Are you looking at a reagent rental? Are you buying it out? What supply methodologies do you have? What is your middleware? Are you ready for integration of technology in your systems? And finally, what are your personal preferences and biases? Because all of us have, at the end of the day. I may like a specific set of instrument and I may not be liking the other one. But when you look at all of this, above all, what still matters is how much money do you have in your pocket? Are you willing to spend? And to earn that money and how you make that money, we have a lecture tomorrow. I think with that, I'll end my talk today. Thank you very much. Should there be any questions, I'll be happy to answer. And I would like to thank my team back home, as well as so many mentors which I've had all the way. Dr. Sue, Dr. Bhargav, Dr. Sukesh, Shirish. Of course, all of them have contributed in some way or the other, and all my technical staff who have actually helped me grow all these years. Thank you very much for your kind attention. I'll be happy to take questions if there are any.